Hello and welcome back to GP Video Podcast by Nadia. So as you know that we have been talking about migraine and types of headaches in our previous two podcasts. We have started off this topic and I just didn't want to leave this topic in between, so we'll be continuing with that. The resources that I have today to share with you are from headacheaustralia.org.au, and I would like to read that out for you and share it with you. So they say that migraine is a common neurological disorder characterized by moderate to severe headache and nausea. While there is no currently a cure for migraine, there are treatments and lifestyle changes that can help patients manage their migraine and enjoy a normal life. Studies have shown that migraine affects over 4.9 million Australians. It is more common in women than men, which is thought to be due to hormonal factors. So hormonal factors can be one of the exaggerating or exacerbating or causative factor in producing migraine. Migraine can begin in childhood but often appears in a patient in their 20s or 30s. It is relatively uncommon after the age of 40. However, different migraine types affect patients in different stages of life. Migraine can be a complex and varied disorder with a spectrum of severity, types, and symptoms. Fortunately, there are a variety of new treatments and research increasing our understanding and helping to more effectively treat and prevent migraine. Because as I said to you that when we say that any headache cannot be named as migraine because migraine has got some particular characteristics, and then once we are officially diagnosed with migraine, then actually we do have a lot of preventer medications that we can be on, and they can help prevent the episodes of migraine as well. So what are the migraine symptoms again? Migraine attacks can have a number of different symptoms and affect patients in different ways. However, there are some symptoms that characterize migraine attacks and set them apart from other headache disorders such as tension headache or cluster headache. As we said, that the headaches are classified into two causes or into two classification groups. One is primary headache, one is secondary headache. Primary headache has got three main types: migraines, tension type headaches, and cluster headaches. So these are the three main types of primary headache, and among them the most common one is tension headache and number two is migraine. So there are differentiating features which differentiate migraines from cluster headaches and tension type headaches. According to the International Headache Society, a migraine can be diagnosed when A, the pain has at least two of the following characteristics. So A is the pain has at least two of the following characteristics. What are they? One-sided, moderate to severe intensity, throbbing, aggravated by movement, that is walking or going upstairs. So always remember that there are actually A, B, C, three criteria. Number one, or A, is the pain has at least two of the following characteristics, which are: number one is one-sided, moderate to severe intensity, throbbing, and or aggravated by movement, that is walking and going upstairs. So out of these four, two should be there for the diagnosis. Then B is there is at least one of the following associated symptoms: nausea, vomiting, photophobia, sensitivity to light, phonophobia, sensitivity to noise. So out of these four, at least one of them: nausea, vomiting, photophobia, phonophobia. Okay, and C is the headache lasts for between 4 and 72 hours. So see how they have made it really simple for us to diagnose the characteristics of the pain, the accompanying symptoms, and the duration of headache. So I will repeat all of this again. For us to diagnose a headache as migraine, there are three criteria, 3 steps, and in 3 steps we have to fulfill a few criteria. So number one is the pain has at least two of the following characteristics. So yes, what I was saying was that the pain should have at least two of the following characteristics: one-sided, moderate to severe intensity, throbbing, number 4, aggravated by movement. So out of these 4, any 2. Then B is there is at least one of the following associated symptoms: nausea, vomiting, photophobia, photophonia. And C is the headache should last between 4 and 72 hours. I will talk more about migraine in my next podcast. See you guys then.